Many on the left are taking aim at Sweden for its refusal to completely shut down their economy and their country in light of COVID. But now a new study claims that targeted lockdowns actually save more lives and do less economic damage. Here to discuss, Fox News medical contributor and author of Make America Healthy Again, Dr. Nicole Saphier. Dr. Saphier, good morning to you.
Good morning, Steve.
Okay, so a couple of MIT researchers looked at the numbers, and they figured that rather than lock down your entire economy, as we have here in the United States, if you simply target it at those most vulnerable, people with particularly over 65, you can have better health care, and at the same time, you won't overwhelm your hospitals, and you don't blow up the economy.
Well, while I do agree with a lot of the aspects of this MIT white paper, which, by the way, I have to say has not been reviewed by the scientific community yet, but it is just a working white paper, they make some valid points in the sense that a targeted lockdown is probably going to be better for the overall economic health of the nation, as well as maintaining some of the physical health of the nation. But here's the thing, Steve. We have to remember that the initial lockdowns of March and April that were so restrictive was to make sure that our health system had time to catch up to the influx of COVID-19 patients. Right. Our health systems were already at near max capacity from flu season, from chronic illness, and they couldn't take in all of the new patients from COVID-19. It wasn't just people over 65 who had to go into the hospital. We had a wide variety of ages in our hospital. Now that our health systems have caught up, we have stocked up on PPE, we have enough ventilators. Now is the time that you really do start looking at more of the targeted approach to protect our most vulnerable as we go into the fall. Those over age of 65, those with pre-existing conditions, right, those who may be overweight, while the rest of the people potentially get back to work. Because as we saw in New York, those from ages 18 to 44, the fatality rate is about 0.18 per 100,000 people. And when 1/3 of the working population are made up of millennials, it makes sense to get those younger peoples back out there to try and stimulate our economy again.
Yeah, indeed. Let's switch gears, Dr. Saphier. Later today, the U.S. Supreme Court is going to hear another case regarding the Little Sisters of the Poor versus Pennsylvania. Remember, during the Affordable Care Act, folks, it was mandated that companies had to provide birth control for employees. But Little Sisters of the Poor said that flies in the face of everything we stand for. Given the fact that this portion, Dr. Saphier, of the Affordable Care Act is going back to the Supreme Court, what do you think that means for the entire act?
Well, you know, I know that we're trying to extrapolate this into a bigger picture when it comes to the Affordable Care Act. The constitutionality has already been up for debate multiple times. This particular case is whether or not that they're going to uphold the Trump's rulings. They ruled to expand religious freedoms when it came to the Affordable Care Act, saying not only were churches exempt, but certain religious nonprofits were exempt, and now even for-profits were exempt. But we have to remember why health insurance was made initially about a century ago. It was a means to entice employees from working under a particular employer. At one point, when we should probably be respecting the freedom of said employer and what they want to offer to their employee. If they're not offering birth control or something of that the employee wants, and it is the employee's right to choose whether they want to be employed there. And right now, we know that there are a lot of jobs who need people to work for there. So it's not that there are a lack of jobs. And so, you know, my personal opinion is I do believe that an employer should be able to offer what they want. It shouldn't be the government saying what they have to, but it's also the right of the employee or the person who's trying to vet for that job, whether they're going to even apply for that job.
Yep, exactly. So let's see. We'll be able to listen to the oral arguments once again live. The Supreme Court will be streaming it. It's all part of Making America Healthy Again, which is a book on your bookshelf right behind you, and a book on my bookshelf as well. Check it out. Make America Healthy Again. Dr. Nicole Saphier, thank you.
Thanks, Steve.